Welcome back, everybody, for another deep dive. Today we're going to be talking about aspirin and colorectal cancer.
Ooh, that's a good one.
Yeah, it is. It's something that we've looked at a little bit before, but there's been some interesting new research that I wanted to dive into with you.
Yeah, for sure.
And so we've got a couple of different sources. We've got this new international clinical trial that's just come out, ASCOLT is what it's called.
Okay.
And so we'll dive into that. And then we've also got some research go back to 2018 from Chen and his team that I think is really interesting that looks at the cellular level.
Interesting.
Yeah, so I think it'll be a good deep dive. So let's just jump right in. I guess, everyone's familiar with aspirin, right? You get a headache, you take an aspirin. You feel a little achy, you take an aspirin.
Right.
But could it also be like a secret weapon against cancer?
Well, that's a great question, and this has been something that researchers have been looking at for quite a while now. And yeah, there's definitely some buzz around this topic.
Yeah, for sure.
Yeah.
So I guess to start with this new ASCOLT trial.
Okay.
This was a massive trial, like 1,500 patients, 11 countries, 66 different clinical centers.
Wow.
Yeah. So this was not like a small little study.
No, this was a big undertaking.
Yeah, they were really trying to get to the bottom of this. So what they did was they looked at patients who had already been treated for colorectal cancer.
Okay.
So they'd gone through surgery, chemotherapy,
Right.
all the standard treatment. And then the question was, okay, if we give these people aspirin every day, can we prevent the cancer from coming back?
Okay. Yeah, that makes sense.
So that was the big question.
So how long did they follow them for?
They followed them for 5 years.
Oh, wow. Okay.
And they looked at disease-free survival rates
Okay.
at the end of those 5 years.
Mm-hmm.
And they were using a double-blind, placebo-controlled study,
Yeah.
which is kind of the gold standard for this kind of research.
Right. Yeah, absolutely.
So neither the patients nor the doctors
Yeah.
knew
Yeah.
who was actually getting the aspirin
Right.
and who was just getting a placebo
Gotcha.
to try to really eliminate any kind of bias.
Makes sense.
Okay, so
what did they find?
well, this is where it gets a little bit interesting.
Okay.
So drum roll, please.
Okay.
The results were kind of not what people were expecting.
Oh, really?
Yeah. They found that taking 200 milligrams of aspirin every day for 3 years
Okay.
did not significantly improve those disease-free survival rates at the 5-year mark.
So it didn't really do anything?
Well, it didn't hurt,
Okay.
but it didn't really help either.
Oh, so it was just kind of like, well, they took a little aspirin.
Yeah, basically. They
Right.
didn't have any worse outcomes.
Right.
But they didn't have any better outcomes either.
Interesting.
So, were you surprised by that?
Yeah, a little bit. I mean, you hear a lot about aspirin and its potential benefits.
Right.
So I guess I kind of assumed that maybe there would be at least a small positive effect.
Yeah. I think a lot of people were thinking that this was going to be, maybe not a home run, but
Yeah.
a solid base hit at least.
Yeah, exactly.
But it turns out that at least for this particular group of patients,
Right.
in this particular context, it just didn't really move the needle.
So then what's the takeaway here?
That's a good question. So I think before we jump to any conclusions,
Yeah.
we need to look at some of this other research.
Okay.
Because I think it helps to provide some context.
Okay. I'm interested.
Let's zoom into the cellular level for a minute.
Okay.
Put on our little microscopic goggles
I like it.
and see what's actually happening inside these cells.
Okay.
So, you familiar with cancer stem cells?
I feel like I've heard that term before, but I definitely need a refresher.
Yeah. So basically, these are sometimes called CSCs.
Okay.
And they're a small but really powerful population of cells
Okay.
within a tumor.
Gotcha.
And these cells are kind of like the masterminds behind the cancer's bad behavior.
Ooh, okay, so they're like the real troublemakers.
Exactly. They're the
Yeah.
ones that are driving the growth and the spread
Yeah.
and even the resistance to treatment.
Wow. So even though they're a small population,
Yeah,
they're really calling the shots.
exactly. They're calling the shots. And so there was this really interesting study back in 2018 by Chen and his team.
Okay.
And they found that aspirin can actually trigger something called apoptosis.
Apoptosis.
Yeah, which is basically programmed cell death,
Okay.
specifically in these colorectal cancer stem cells,
Oh, wow. So even though it wasn't preventing the cancer from coming back,
right?
in that big trial, it might actually be killing off some of the most dangerous cells.
That's the idea.
Wow, that's pretty amazing.
Yeah, it's a really interesting finding.
So how is it doing that?
Well, this is where the science gets kind of cool.
Okay, I'm ready.
So imagine aspirin enters a cancer cell.
Okay.
It goes right for the nucleus,
Okay. The control center.
the control center exactly. And once it's inside, it interacts with a specific protein called P300.
Okay. P300.
P300.
Yeah.
And this interaction
Yeah.
triggers a whole cascade of events
Okay.
that ultimately lead to the activation of a gene called fast cell.
Fast cell.
Fast cell. And fast cell is a death receptor.
Okay.
So basically, when it's activated, it sends a self-destruct signal to the cancer stem cell.
Oh, wow. So it's like aspirin is setting off this chain reaction
Yeah.
that leads to these dangerous cells just kind of eliminating themselves.
That's a great way to put it.
Yeah, that's amazing.
And what's even more fascinating is that this pathway seems to be specific to cancer stem cells.
Oh, really?
Yeah, because of some differences in non-cancer stem cells.
Yeah.
Aspirin seems to have this unique ability to really target those.
Wow, that's fascinating.
Yeah, so it's kind of like a seek and destroy mission.
Yeah, it's like a smart bomb almost.
Exactly.
Wow.
So now we have this big clinical trial that's saying, okay, aspirin doesn't prevent the cancer from coming back.
Right.
But then we have this cellular research that's saying, well, hold on.
Right.
Aspirin might actually be taking out the ringleaders.
Yeah, that's kind of a head scratcher.
Yeah. So how do we reconcile those two findings?
That's a great question, and I think that's what researchers are still trying to figure out.
Yeah.
It's possible that aspirin's effect on these cancer stem cells might be more relevant in other contexts.
Okay, like what do you mean by that?
Well, remember that the ASCOLT trial was looking at aspirin's ability to prevent cancer from coming back after standard treatment.
Right.
So maybe aspirin's real strength lies in working alongside other treatments.
Okay, so instead of being a solo act, it's more of a team player.
Exactly.
Okay.
And there's actually some research to support this idea. Chen's team also looked at aspirin's potential as an adjuvant therapy,
Okay.
which basically means using it in conjunction with standard chemotherapy drugs.
Gotcha.
And they found that aspirin actually helped to make cancer stem cells more vulnerable
Okay.
to a common chemotherapy drug called oxaliplatin.
So it's like a wingman for the chemotherapy.
Yeah, exactly.
Boosting its effectiveness.
Yeah, boosting its power.
Okay, that's really promising.
It is, but we need to be cautious. These findings are exciting, but we need more large-scale clinical trials
Yeah.
to really confirm whether aspirin truly works as an effective adjuvant therapy.
Right. It seems like there's still so much we don't know
Absolutely.
about aspirin's role in fighting cancer.
Yeah. And to make things even more complicated, we also need to consider how aspirin's effects might vary depending on a person's individual health conditions.
Okay, so another layer of complexity.
Yeah, there's a study from the National Cancer Center in Korea,
Okay.
led by Anani, and published just this year in 2024.
Okay, so this is brand new research.
Yeah, hot off the presses.
Okay, what do they find?
Well, this study looked at the relationship between aspirin use,
Okay.
something called metabolic comorbidity.
Metabolic comorbidity.
Yeah, basically means having both hypertension and diabetes.
Oh, okay, so two very common conditions.
Unfortunately, yes, very common. And what they found is that having both of those conditions was linked to an increased risk of colorectal cancer overall.
Okay, that makes sense.
But here's where it gets really interesting. Aspirin use showed a negative association with both overall and site-specific colorectal cancer risk.
So even for people who are already at higher risk
Yeah,
because of these other health conditions,
exactly.
aspirin seemed to offer some protection.
That's what the data suggests.
Wow, so it's adding yet another dimension
Yeah.
to our understanding of this whole thing.
It really highlights the potential for personalized approaches to cancer prevention.
Right, because what works for one person
Right.
might not work for another.
Exactly. And what might be beneficial for one person could actually be harmful for someone else.
Wow, so much to consider.
I know, it's a lot to unpack.
Yeah, it's turning into a very full suitcase.
It is.
But it's fascinating, right?
It is. It's really fascinating. It just shows how complex this relationship is between aspirin and cancer.
Yeah, and how much more research we need to do.
Absolutely. We've only just scratched the surface.
Well, I'm ready to keep digging.
Me too.
Let's dive in.
Wow. I'm still processing all that.
I know, right?
Ah.
It's a lot to take in.
It really is. It's like we're trying to solve a puzzle with like half the pieces missing.
Yeah, it's definitely a complex picture.
So one thing that's really been on my mind is all this talk about aspirin's impact on survival rates.
Right.
Like we've got some studies saying it helps with overall survival,
Yeah.
others saying it helps with both overall and cancer-specific survival.
Uh-huh.
But then that big ASCOLT trial showed no benefit in preventing the cancer from coming back.
Right.
It's kind of confusing.
I know, it seems contradictory.
Yeah, how do we make sense of all that?
Well, I think it's important to remember that each of these studies
Yeah.
has its own unique methodology.
Okay. So it's
Wow.
not just about what they found, but how they found it.
Exactly.
No.
You've got it.
Mm.
And factors like the specific patients included in the study,
Uh-huh.
the dosage of aspirin used.
The duration of the study,
Yeah.
and even the specific outcomes they were looking at can all influence the results.
Right. So it's like we can't compare apples to oranges.
Exactly. We need to be really careful when interpreting these findings.
Makes sense. So I guess that's where expert analysis comes in.
Absolutely. We need people who can look at all the evidence,
Yeah.
weigh the strengths and limitations of each study,
Oh, okay.
and help us understand the big picture.
So you mentioned meta-analysis earlier.
Right.
Could you explain a little bit more about how that works?
Sure. So a meta-analysis is basically a statistical technique
Okay.
that combines the results of multiple studies
Gotcha.
on a particular topic.
So it's like pooling all the data together.
Exactly.
Yeah.
To see if a clearer pattern emerges.
Okay, that makes sense.
Yeah.
But even with meta-analyses,
Yeah.
it sounds like we still need to be critical thinkers.
Oh, absolutely. We can't just blindly accept the results.
Right.
We need to consider the limitations of the individual studies,
Right?
be aware of any potential biases, and really think critically about the conclusions.
So much nuance.
I know, right? But that's science. It's not always black and white.
Definitely.
Uh.
So I guess one of the big questions that comes to mind is dosage.
Mm-hmm.
Like most of the studies we've talked about have used doses ranging from 100 to 300 milligrams a day.
Right. Pretty standard for over-the-counter aspirin.
Yeah, but is that the optimal dose for everyone?
That's a great question. And we don't really know the answer yet. Could a lower dose be just as effective?
Okay.
Or could a higher dose be even more beneficial?
Or could a higher dose be too risky?
Exactly.
The-
We need more research to figure that out.
And then there's the question of who might benefit most from aspirin therapy.
Right.
Is it everyone with colorectal cancer?
Yeah.
Or are there specific subgroups of patients who are more likely to respond?
That's a key question. And it gets back to that idea of personalized medicine.
Right. Tailoring treatment to the individual.
Exactly.
So cool. So I guess another big question is prevention. Like, is there any evidence to suggest that aspirin might help prevent colorectal cancer in the first place?
Yeah, that's another area of active research.
Okay.
There have been some studies suggesting that long-term aspirin use might reduce the risk,
Okay.
but the evidence is still mixed.
So more research needed there too.
Absolutely. And even if there is a preventative effect,
Yeah.
we have to weigh that against the potential risks.
Right, because even over-the-counter meds can have side effects.
Exactly. Especially when taken for long periods.
So it's all about that risk-benefit analysis.
Exactly. Finding that balance.
It's a lot to consider.
It is.
Yeah.
But that's why it's so important to talk to your doctor.
Right.
To have those open and honest conversations.
Get their expert opinion.
Exactly. They can help you make the best decision for your individual situation.
This is all so interesting. I feel like we're just scratching the surface here.
I know, me too. There's so much more to explore.
Well, I'm ready to keep digging. Let's move on to the final part of our deep dive. Okay, so we're back for the final part of our aspirin deep dive. And I have to say my brain is officially full.
I know, right? We've covered so much ground.
It's a lot, but it's so fascinating.
It really is. There's just so much to unpack when it comes to aspirin and cancer.
Okay, so one thing that I keep coming back to is this idea of personalized medicine.
Right.
You mentioned it earlier, and I think it's so important.
It is. It's really the future of medicine.
So can we talk a little bit more about what that looks like in the context of aspirin and colorectal cancer?
Sure. So basically, personalized medicine means tailoring treatment decisions to the individual patient.
Okay, so instead of a one-size-fits-all approach?
Exactly. It's about moving away from that.
Okay.
And instead, we're trying to develop treatments that are based on a person's unique genetic makeup, their lifestyle, and even the specific characteristics of their tumor.
So in the case of aspirin, it's not just about saying everyone with colorectal cancer should take it. It's about figuring out who's most likely to benefit.
Exactly. And who might not see any benefit or even experience negative side effects.
All right, because we talked about those studies
Yes.
that looked at aspirin's interaction with certain genes.
Yeah, that's a perfect example of how we can use genetic information to personalize treatment.
So if we can identify those genetic markers
Right.
that predict a positive response to aspirin,
Yeah.
we can make sure that people are getting the most effective treatment.
Exactly. And we can also avoid giving aspirin to people who aren't likely to benefit.
Right, so we can minimize those potential side effects.
Exactly. It's all about maximizing the benefits and minimizing the risks.
This is incredible. It feels like we're on the verge of a whole new era of medicine.
We are. We really are. It's a very exciting time to be in this field.
But I know you said there are still some hurdles to overcome.
Oh, of course, there are always challenges.
Like what kind of challenges?
Well, for one thing, we need to develop reliable biomarkers
Okay.
that can accurately predict treatment response.
So we need a way to identify those people who are most likely to benefit.
Exactly. And we also need to gather more long-term data on aspirin's effects in different populations.
Right, because what works for one group of people might not work for another.
Precisely. So there's still a lot of work to be done.
But the progress is really promising.
It is.
Yeah.
It really is. And it's not just about genetics either.
Okay, what else is there?
Well, we also need to consider the role of lifestyle factors.
Okay, yeah, that makes sense.
You know, things like diet, exercise, smoking habits, all of those things can have a big impact on cancer risk.
And those same factors could influence how someone responds to aspirin therapy.
That's exactly right. And there's growing evidence to support that idea.
Really?
Yeah. For example, there was a study published back in 2012 that found that aspirin's ability to reduce colorectal cancer risk was strongest among people who ate a healthy diet.
Wow, so it's not just about popping a pill.
Yep.
It's about taking a holistic approach to health.
Got it.
Yeah.
It's about making healthy choices in all areas of your life.
I love that. It's about empowering people to take control of their own health.
That's exactly what it's about. And that's why I think resources like this deep dive are so important.
Right, because we're giving people the information they need to make informed decisions.
Exactly. We're helping them understand the complexities of this topic and make choices that align with their values and goals.
Well, I have to say, this has been an amazing conversation.
It has been. It's been a real pleasure.
We've covered so much ground.
We have, from those big clinical trials
Yeah.
to personalized medicine to the importance of lifestyle choices.
It's been a whirlwind.
It has. But I hope it's been a valuable one for our listeners.
I think it has.
Yeah.
So as we wrap up, what are some key takeaways you'd like to leave people with?
Well, first and foremost, I think it's important to remember that aspirin's relationship with colorectal cancer is complex and nuanced. There's no easy answer, no magic bullet.
Right, there's still so much we don't know.
Exactly. But research is ongoing, and we're learning more all the time.
And in the meantime, it's about making informed decisions.
Absolutely. Talk to your doctor, weigh the potential benefits and risks, and make the choices that are right for you.
This has been an incredible deep dive. I feel like I've learned so much.
Me too. It's been a great discussion.
To our listeners, thank you for joining us on this journey into the world of aspirin and colorectal cancer. Stay curious, stay informed, and most importantly, stay engaged in your own health journey. We'll see you next time for another deep dive.